Hi students, today we will discuss about the sample size calculation. In medical research, determining the appropriate sample size is a critical step in study. A study with too few participants may fail to detect the real effect, while one with too many participants may waste resources and expose more subjects than necessary. For randomized control trial, the objective of our study is to evaluate the efficacy of a telephone-based intervention to improve care and clinical outcomes in type 2 diabetes. For this purpose, we consider a reference article and search the efficacy of telephone-based intervention among patients with type 2 diabetes, a randomized controlled trial in pharmacy practice. We consider this article for a reference. This is the table 4 of this article at 9-month intervention group and control group adherence. We use high adherence, which is equal to 8. The intervention group 63% adherence and high adherence, and control groups 22.9% high adherence. We use these two percentages for sample size calculation. We open the cohort in RCT sample size option and we put the value 63%, 4% of unexposed with outcome, and 22.9% of exposed with outcome, and press the calculate button. Here, exposed and non-exposed group, intervention and control groups, we have 24 subjects for intervention group and 24 subjects for control groups. Please subscribe and like our channel and press bell icon for more videos.